For more than 40 years, MercyOne Des Moines Medical Center's care teams have relied on simulation to train clinicians to provide the most advanced and safe patient care through the use of technology. Simulation allows care teams to act in real-time, life-saving scenarios with precision and coordinated care. Our simulation labs are used by clinicians of all levels, our patient care techs, nurses, residents, and physicians. Providing safe medical care is our top priority at MercyOne. Each year, thousands of Americans across the United States die from preventable medical mistakes. Regular simulation of medical procedures with interdisciplinary teams focuses on providing the safest care possible for our patients. Under the guidance of experienced instructors, nurses learn to think on their feet, make quick decisions, and work as a team. A simulation lab bridges the gap between theory and real-world practice, enabling our care teams to put new skills to work in complicated and emergent situations without putting patients at risk. MercyOne incorporates 3 high-fidelity mannequins into its curriculum to teach advanced patient care techniques. Surgical residents benefit from hands-on experience with robotic surgery through 2 dual-controlled simulators.
And the best thing about working with a simulated experience is the potential to make mistakes, knowing that that's okay because we're just going to reset the mannequin and do it all over again. It promotes a lot of muscle memory for things like phlebotomy practice, IV starts, anything like that without causing any patient harm. It can also just create this psychomotor response to a high-intensity situation like coding a patient, delivering a child, something like that. So it's an opportunity for us to really practice some of those things that we're going to see every day without having to go and try it on a patient first. So it really creates a comfortable environment where you can ask questions, pause to discuss what we're doing. It feels safe, it feels supported. So having the opportunity to talk through these situations and make those mistakes and ask those questions and develop your confidence and competence in those is a huge benefit. Simulation is never going to replace a real experience, but like I said, it really does help promote that muscle memory or that psychomotor response so that when you're in that moment, you feel comfortable knowing that I've done this before, I at least have an understanding of this and feel good about where I'm at.
Our current simulation labs are small and located in a variety of areas throughout the medical center. MercyOne Des Moines Foundation is working on a campaign to build a new simulation lab. The new space will consolidate each of the current individual spaces into one state-of-the-art space.
During this year's annual campaign, the Simulation Lab project is one of our funds of focus. It is vital for us to retain our highly skilled healthcare workers to care for our growing and aging community. This project provides the tools needed to serve patients in the most acute scenarios without putting them at risk. Your contributions will directly impact the quality of education for our nursing staff and providers, ultimately improving patient care in our community.
Please join us in investing in the future of healthcare by supporting the SimLab project. Together, we can make a difference.